All right, let's look at this case. Okay, so patient is a young patient, 25-year-old with low backache. Okay, grossly, when you look at it in the sagittal plane in this T2-weighted image, you're not really seeing any significant discs. The discs all look very well hydrated, but you should always be careful whenever you see a vertebra which is looking almost of the similar dimensions as the lumbar vertebrae that is tilted and pointing towards the sacral elements. You should wonder, is there an element of transition? Okay, so I'm going to switch to a coronal plane just to show you what exactly is happening in this. Okay, so if you see here, if I were to come from a higher level, you can see that probably the last articulating ribs are posteriorly are at this level. So if I were to assume that this is a T12 or a last thoracic vertebra, then this would be L1, 2, 3, 4, and 5. Now, if you look at the fifth lumbar vertebral body, as you can see here, it's got enlarged transverse processes on both sides, which appears to be fairly completely fused with the sacral elements S1. And if you can identify here, you can see the iliolumbar ligaments, the ligament that is going from the transverse process of L5. Okay, so this is a case of a completely fused enlarged bilateral transverse process. So when both the transverse processes are completely fused, in the Castelvi classification, B stands for bilateral. So this will be a type 3B type of transitional L5 vertebra.